Okay, everybody. Sorry again. We're just again about 12 minutes running behind. Seems to be our theme for the last couple of days. Thanks for rushing your lunch a little bit. You're going to hear again now from Dr. Shay Tanis. You heard from her yesterday. You've heard her answer so many questions. I don't think she needs any further introduction. After Dr. Tanis, we're going to have a self-advocate panel and one more speaker, and then we'll do a little more conversation. So please help me welcome again Dr. Shay Tanis.
Thank you. And I'm going to be honest, I am going to be faster on my slides today because I really want to give time to the advocates that are coming here to hear from, because I really think they're the ones you need to hear from. You don't need to hear from me twice. But I do want to give you some critical information as legislators. So I'm going to talk about technology, and it is an area we've been working in quite some time. And the questions we've been seeing and the data we've been collecting is why technology and why now? So if I said to all of you in this room, for the next hour, you will have zero internet connection and you cannot use any of your technology, how many of you are going to run out of this room as fast as you humanly can? Correct. Many of us would. And it's because we are attached to our technology. If you look at the data and you look at teenagers, they would rather lose a finger than lose their technology. So we are in an age where technology is really driving everything we do and our interact, and it really is how we survive, but it's also how we're going to thrive in the future. It's also the jobs that we're going to need in the future is interacting with these technologies. And so we've looked for a while, and I think it's right here. So in 2010, 2011, I was fortunate to be a author on what was the Declaration on the Rights of People with Cognitive Disabilities to Technology and Information Access. The first entity that really talked about the principles around ensuring people with disabilities had access to technology, specifically those with cognitive disabilities. And it seems like some time ago, but this really catapulted because what it did is it was endorsed by the President's Committee on People with Intellectual and Developmental Disabilities and the Federal Communications Commission. And so looking across the board at what kind of policies are really needed, what change is needed, this was a first step in what we were doing. And many of our national associations, the ARC, AAIDD, many that you've heard from today endorse this as a starting point in addressing technology. But we've come so far. We still have a number of different barriers we have to address with technology. Lack of inclusive design, things about use-worthiness. I use this a lot, that it's great to have a piece of technology, but if you don't want to use it, if it's bulky and ugly and embarrassing, you're not going to use it, so it's not use-worthy. It has the function, it'll serve the function, but it's not worth using. We saw a lot of that with the Federal Communications Commission when they gave free technology out, when they were giving out cell phones. But they were old phones that didn't have any of the accessibility features in them. And so they weren't use-worthy. We really don't have that literacy. We have not been training students with disabilities about technology and skill sets in their general ed curriculum, in those curricular models. And there are really some gatekeepers that do prevent. Oftentimes, they're folks that have unintended gatekeeping, so folks that themselves are uncomfortable with technology. So family members sometimes, direct care professionals, unintentionally become gatekeepers of tech. And lack of supports, being able to train on it, and systemic barriers. And I will tell you, I say economic barriers last. And the reason I do that is because we have tracked the funding of technology solutions since 2007. And you saw some of that data. And there is money out there, and there are monies from different sources. What we don't know is how to navigate that. We don't know how to direct people to the right sources. And so some of the things we've been working on since that time is systems change approach. And when we are looking at systems change, it's not a pilot, it's not a program, it's an entire ecosystems change. It's intended to transform the way our current systems work and create new behaviors and patterns that allow for those barriers to be eliminated. And so we started working on, with all of our technology-first states, we started working on thinking about how to do this and lessons learned. Over the years, we've even, and I apologize, I'm talking fast because I want to go for the advocates. Over the years, we've really even tried, if you want to see efficiencies, if you want to see better use of funding dollars, we are looking also at integrative systems. How do you integrate systems change models? We know that technology first and employment first are based in person-centered practices. There is a way to integrate all of those things in a comprehensive way. Our colleagues over at the University of Boston, Massachusetts Boston, who collect the national data on employment first and employment services and do systems change, we came together and we did a presentation with Julian, who you'll actually hear from in a minute, around how do we do this true integration of systems change. We don't need separate systems. We need comprehensive systems that integrate what is the person-centered approaches, the employment-first approaches, and the technology-first. We called it the firsts, right? Because we use that for everything. But really, what comes first? And it is the individuals, always, when we start there. But we talked about where these commonalities lie and how we can align those individual practices that are going on in your states. And so we started thinking through that over time. But really what I wanted to talk about today, because I think all of you are in a very important position to make some change on this. So technology first systems change really came out of work that was done in Ohio back in 2017. I served on their council when they were doing that. And it started at looking at a framework where when we talk about support options, technology is considered as the first option before we go to people. We make sure that it's not the only option, but it is an option that we start to focus on as a potential. Not only because it promotes autonomy, it's what is accepted by our general culture, and it is things that we have seen increase some efficiencies. And so we started looking at what is really this technology-first systems change model, and what are the component elements. We were really excited this year when the President's Committee again highlighted our work and talked about technology-first systems change being one of 6 principles considered pivotal in strengthening and sustaining the nation's HCBS infrastructure. And we have the model up at the site, but being able to use technology first as an option in your states is something that you can drive. So you heard a lot, Jeremy talked about some of the key pieces that his colleague Milton uses. Many of those are aligned in what is our systems change model, which is based in implementation science. Implementation science that is driven by health and human services, what we know works to transform health and human services, those legacy systems that are so difficult to transform. And so we have this model that we have outlined on what will work, what is needed to have true systems change around technology. And we've had over the years and worked with what is our Technology First State consortiums and a number of different groups, been able to partner with our colleagues at the National Association of State Directors of Developmental Disability Services now twice to do a national survey, and we're building the longitudinal to benchmark states to see where you are on what we have as these principles of systems change. And we've even grown it out to be a maturity model with a whole bunch of different variables in there. Things like, are you employing people at the state agencies with disabilities in technology-related positions? Do you have people who are being trained in K through 12 focusing on technologies in their professions? Things like, are you training family members to be able to participate in learning and design of technologies? So it's really expanded, but we nationally rank states. And we have, you'll notice some of our friends here, Oklahoma, Tennessee, are moving up in all these benchmarks. And so now we have a number of different states that have initiated this as a priority. We've also, in our national surveys, we have surveyed the Anchor, which is, you heard from Gabrielle the other day. They're a partner of ours. The providers across the nation, we've done surveys, 2 surveys with them, to say, is there alignment between the state and providers and what they do? We have seen huge gaps in knowledge on funding mechanisms. So where the state will identify 12 different funding authorities for technology, providers only know 2. And so part of what we're trying to do is create a national database so we know how to move forward, how we know where the gaps lie. And when we start to talk to our states about, is this a priority to you? They say, absolutely. We have, of the states identified when we do these surveys, they say, we want to implement technology first. We want to identify strategies. And these are kind of the reasons they say they want to do it. Why do we want to do technology first? Number one, it increases autonomy and independence for individuals. It allows them to control their environments and engage in what we call the natural routines and rhythms of American culture. The routine and rhythm of all of us looking at our phones is one of those, okay? Those are naturally occurring routines and rhythms of our environment. And so that's the priority, increasing quality of life, increasing engagement and autonomy. The other thing we have seen by states, and we can prove now with the data, that providers can demonstrate what is workforce shortages and cost-cutting strategies and efficiencies using technologies. And when I talk about it, I'll say technology solutions. It's one of the terms I use. It's an umbrella term to be able to capture the variety of technologies, but it also helps look at those cost efficiencies. And so states are wanting to do this. Providers are wanting to look at it. And so it's an area of growth. The ones that say, I don't know, and I know these states, it's because they didn't know if they were already doing it. They knew that there was some initiative and they weren't sure. So there's a number of different states doing this. And what we are looking at from a national perspective, from a project of national significance, is really, do we have success? And it's part of the model is, are we seeing policies and practices align with technology definitions? You heard Miranda, we were on a call with some of our National Association partners around this definitional policy. So do we have alignment? Does technology mean the same thing across waivers? And can people essentially get access to them? The other one is, do we know that we are having training, and I talk a lot about this, it's not only, when we talk about accessibility, it's not only that first handoff of, did you get it in hand? Okay, that's one step. We have to know about, can you use it long term? Do you have sustainable training to help you with that? And so we start to talk about not only data literacy, but data resilience and agility. How do you transform when that changes? Do you know the classic, this is my favorite example, what do you do when your computer or technology doesn't work? What's the first thing you do? Scream? What's another first thing you do? Turn it off and turn it on. Anytime you call an IT professional for IT support, first thing they will ask you, did you turn it on and did you turn it off? The problem is we don't teach that. So what'll happen for people is they won't know how to use it and they'll put it in a corner and it'll be abandoned. So that's kind of this resiliency how do we deal with problems with our technology when they happen that allow us to continue to use it? Are we reducing in our systems change barriers? Attitudinal barriers. We have a lot of folks who have fear of technology for people with disabilities because they're afraid that they're going to be violated, victimized, etc. We have heard for years that for providers, we can't let people with disabilities use technology because it's a violation of HIPAA. Okay? So these attitudinal changes about people with disabilities using technology. Making sure we're working with practitioners and developers who are designing technology so we're not retrofitting them. And there are a lot of initiatives around what we call inclusive design. Inclusive design ensuring that people with disabilities are the ones at the table from the beginning to the end of design of the product. And I'll tell you what, the majority of the best designers are the ones with lived experience because they know what solutions are needed. Financial access is always a sticky point, but knowing how to navigate the finances. Policy parameters and the identification. Where do you go if you even want a technology? These are some of the metrics that we have in the systems change model to make sure we are really having success. The other thing is kind of maturity and having fidelity in the model. So I'm a big person on fidelity of measurements because I think it's really hard if you are trying to look at the nation when you don't have consistency in the way people are reporting. And so we're trying to have some consistency in how people report their use of technology. Because we are one of those entities that do not track people with disabilities nationally in their technology needs, uses, or applications. So we have some limited national data, but not data that really tells us how we can develop over time. So we started doing that. We were really lucky. We were able to start in 2019, pre-pandemic, with our state directors. And 2019, 2020 with the providers. And then we were able to see the transformation that COVID put into play because we measured it afterwards. The amount of growth in technology use, funding flexibilities, innovation in pilot programs really was catalyzed by the pandemic. And it allowed us to look at technology solutions in a different way because we had no other choice. We had to move to medication dispensers for people with disabilities because no one was there to give them their medicines. We had to move to telehealth, telecare because people weren't going into the homes. And so we had this opening where we were able to try a whole bunch of new things and reimagine the way that we actually do our work with the support of technology. And so there are some key questions we still try to answer. Do people with disabilities desire and need access to technology solutions? I will tell you, and if you go to a presentation, I'll give you a spoiler alert for NCSL in 2 weeks, there is a study that I always cite that was the Australian Bureau of Statistics, their census for Australia. And they captured usage of internet. And what do you want me to do, Stacy? Sorry, excuse me, one sec. Oh, I want to make sure we get our advocates on, and I know some of them are virtual. Stacy, do you want me to wrap up for the advocates? Okay. Okay. And what I loved about that study is they asked, what is the thing preventing you from using the internet? Again, what would you guess the answers would be? What do you think? Why weren't people with disabilities using the internet? They don't have the technology. Any other guesses? Can't afford it, big one. Any other guesses? Gatekeepers? I'll tell you the answer was, we don't know why we'd use it. We have no interest. Right? So think about how that data transforms the things that you do. If you thought the barrier was funding, you're going to go after a whole program that's focused on funding. When you find out that people don't use it because they've never been exposed. Very different issues. So we still have these key questions. What are the technologies they're desiring? And usually they're the most common. I'll give you a hint. Do they truly have access? And there are many portals of access, funding, training, utilization, et cetera, accessibility in terms of the product. Do we as a society build environments where they can use them? So in provider associations and providers in their group homes, are we providing an opportunity and an environment where they can use those technologies? I'll tell you, one of the big barriers we always heard was, I live in a group home and I have a computer. So we'd say, what technology do you have? I get a computer. I get a computer in my group home. When do you get to use that computer? Oh, I don't get to use that computer. No, it's there. We own a computer. But that's for other people, and if I get it at 4 o'clock for maybe 20 minutes. So we started asking other questions. Do you own technology, can use it anytime you want? How do we use the technologies to support the workforce? Are we making the workforce job more efficient where they can spend the time they need, not filling out paperwork, but doing the work of working with people and having that companion care? Do we have the knowledge so people can make decisions about the technologies they want? Have they been exposed to all the options that we just Google to know whether or not they can use them? And most importantly, does the technology improve their quality of life? Does being on Facebook, which we've seen, expand the repertoire of people they can communicate with? Does using Uber as a transportation allow them to engage in different activities? So we want to see that over time. Here is an example of the technology solutions that were funded pre and post-pandemic. So things like, I know you can't read these all, assistive technology, durable medical equipment, wearables, computers and tablets, smart home technology, smartphones. And you will see the red was 2019. The blue is what happened after the pandemic. The growth in the technology solutions that people are using and taking advantage of, and funding, this is by the number of states that were funding, increased substantially. So we use a lot of evidence-based tools when we're thinking about technology first, and many have been developed by those providers, by the states you've been hearing wonderful things about. So things like our benchmarks and maturity model to see, are states all progressing and where can we fill the gaps? Things like, and you've heard the term AbleTech or AbleLink a couple times from our partners at the other states. We use them too. They are out of Colorado, and they have the one cognitively accessible platform for survey development based in research on how to complete surveys for people with cognitive disabilities. We use that for our technology needs and barriers access. So we want to see from people with disabilities, are you using technologies and what are the barriers? We've had that working in different states. We've used that in Oklahoma. We also have what is our technology resilience and agility questionnaire. Do you know what to do when technology goes wrong? Do you know what to do when you are looking for technology or they're pairing inappropriately? Basically, it's the technology-based skills. Do people with disabilities have them? And how can we grow them? We have a readiness evaluation. We've been partnering with Pennsylvania as a tech-first state. We've done a couple things with them. One is helping providers get ready for being, we call it a culture of innovation. There are ways to set up provider associations to be able to use technology in different ways. But there has to be a culture of innovation. You have to have certain pieces in place to allow them to be successful. And so we've done that in Pennsylvania, and it's customized to their state. We also focus on technology solutions specialists. Now, you heard about technology champions. There have been amazing technology champions, and if you're in a state that has them, use them to your advantage. We're working in Pennsylvania to make sure that our technology champions, we call them technology solutions specialists, because that term actually comes from the Department of Labor. When we see people going into the areas of technology, what are the job careers? What are the titles that align with technology jobs? Specialists is one of those titles that puts you in a pipeline excuse me, for a technology position. And that is what we are trying to prepare these folks to do. We're training them to not only be the ambassadors of technology in their state, but also to work for tech companies, to be able to be the ones developing the technology. And then we have another program that's developing a case manager training. The state of Kansas, we have a new Technology First Award, where we'll be doing some of that work and training up some of their case managers around how to identify technology solutions using what is a self-directed model that comes out of self-determination. We know for years of our work in self-determination, it's where my background is, that there are certain ways to set goals, and we know how to do that in the technology space. It's the same application, just applied to technologies. And so here are a couple things that we have been working on that all go into some of these amazing things that you heard from our other partners. People are doing this innovation. We have the wearables for wellness, looking at our people. Think about this for a minute. How many MCOs are using managed care, or healthcare providers are requiring different wearables for health monitoring and for preventative monitoring? We want to make sure that through this, we give guidance to them that if they're choosing a monitor, it's not like wearing a anklet that you have to wear and be monitored by. We want people to know how to use that data and make sure it's all accessible to them. So we want to have wearables that are accessible to people. As I mentioned, we have the Pennsylvania Tech Accelerator, where we're advancing tech first. We're working with Adobe in terms of identifying icons that are cognitively accessible. So how do you communicate with a population? What we do know is that icons are helpful both nationally and internationally in understanding language. We have low literacy levels for our community, but yet we have no consistent lexicon, no consistent symbology that we use. So we're working with our self-advocates and Adobe to create that, identifying words like intellectual disability, self-determination, Medicaid. That'll be public on there and free of use through Adobe. And then also internationally, we've been looking at AI in the career market. How do you use AI to scaffold learning to build careers? So a lot of this is around technology, but there's a lot that you can do. So what we know is that 7 states are currently considering their state to be a tech-first state, okay? And what that means is they've gone through some of the processes, they've put in place many of the things you heard from Tennessee and Oklahoma to be able to move technology forward. But we also know that states want to get there, and they don't feel that they are a technology-first state without legislation. We've worked for years in trying to promote the rights of people to get technology and access. What we know is you have to have teeth to a policy to make it happen. And so this is where you come in. We have 13 states that are currently working on legislation. Most of the legislation that's already out there is executive orders, governor executive orders, but most states are looking to make it happen, but yet they don't have the partnerships. In Pennsylvania, we're working with Representative Hohenstein and creating a technology-first legislation. And there are things that we even know. What can you put in that legislation? We have criteria that we've seen from our wonderful states that have been working, harmonizing and modernizing our policies, making sure you have cross-agency collaboration, ensuring engagement of training and literacy and agility, expanding what is braided and blended funding, invested in hybrid models of innovation, accountability with data, and impact measurement. These are the things you can do. You can be what is the next champion of a tech-first initiative in your state. You can be a lead here. I'm going to mention we are working with Advancing States, which is aging, and NASDs, which is our disability. Blending the aging and disability and policy with the Centers on Medicare and Medicaid around how do we make sure that our policies are aligned and endorse all ranges of technologies that people want to use. So there's a lot of work going on, and I'm going to stop there because I'm trying to get fast for these guys. There's a lot that you can do. You guys are the ones that the states are looking to help develop a bill, advance it, and be the champions of the next tech-first model in your states. So I will tell you, you can contact me for any information. We're happy to share the policies that are happening in other states, their legislation that's happened in other states. Those that are working on legislation, we can point you to the groups that are doing it. But I think there's so much opportunity for this group to really be the leaders in this space. So I'm going to stop there so they have enough time.
You're the best.
Yeah. Did I go fast?
We do have a minute for a question or two,
Oh,
though,
okay.
Dr. Chen. Anybody?
I was really trying to go fast.
She's still here. You did an amazing job. You did great. And we're right on time. Look at that. We made up 12 whole minutes. Okay. Well, then we will move on to our self-advocates panel if people don't have more questions. Thank you so much.
Yeah, sure.